Most people walk into their first plastic surgery consultation nervous and walk out relieved. Not because the decision gets easier, but because clarity finally replaces confusion. I'm Dr. Kenneth Yu, a facial plastic surgeon, and I spend a full hour in your first consultation with you, no interruptions, so you walk out with confidence, not questions. This isn't about a quick sign here visit. It's a deep dive into understanding your goals, your anatomy, and the best way to get you where you want to be, realistically and safely. So in this video, I'm going to walk you through exactly what happens step by step from the moment you walk in to the moment you walk out, so you know there are no surprises, just answers. The first part of your consultation is about you, not the procedure. I'll ask you what bothers you the most, why it matters to you, and what results you hope to see. This is where I learn what matters, not what someone else said should matter. Your goals shape the plan. Then we review your medical history, past surgeries, medications, and any concerns that could impact safety or results. This helps ensure that your outcome isn't just beautiful, it's safe. Next, I'll examine your anatomy, gently, respectfully, and with purpose. Whether it's your nose, your eyelids, your jawline, or another area, I look at your proportions, your skin quality, your bone and soft tissue structure. This isn't about quote-unquote fixing flaws, it's about understanding unique features of your face and how changes will look in harmony. Now I will take photos and sometimes measurements. This helps me plan your treatment and document your baseline so that future comparisons are clear and accurate. This is where the consultation becomes strategy, not speculation. I'll outline what's realistically achievable, what isn't advisable, and multiple approaches you can take. Some patients need surgery, while others may benefit from non-surgical options first, and some patients choose a combination. No one size fits all, just a plan tailored to you. You'll leave knowing what treatment fits your goals, not just what looks good online. We'll talk about what the procedure actually involves, recovery timelines, what feels normal versus what doesn't, and then risk you should know. Good outcomes aren't just about how you look, they're about how you feel and heal afterwards. You should never walk out wishing, boy, I wish I had known that. This part is yours. Ask anything, no question is too small, no concern too trivial. We go through checklists one by one because informed patients make the best decisions. And if you need to come back for more questions, I'm happy to see you again. If you're ready to move forward, we'll talk about scheduling, logistics, and what happens next. If you're not okay, that's okay too. Your comfort and confidence comes first. Your first consultation isn't about selling you surgery. It's about building a plan that feels right, looks natural, and respects your goals while keeping your safety at the center of every choice. You're not a number, you're not a procedure. You're a person with a story, and that story starts with understanding what's possible for you. If you're curious about a specific procedure or want to hear what others have asked before, leave your questions in the comments. I'll be answering them in future videos.